Hi, everyone. So happy you are back. As you can see, we have Dr. Beth with us again. Yay, we just love when she comes with, visits our show. So today, Dr. Beth is going to talk about everything thyroid. And I cannot wait to hear what she has to say. So without further ado, Dr. Beth, hello.
Hello, Michelle. Thank you. As always, I really love being on this podcast and show with you amazing ladies. It's just, I think it's such a powerful collective. And I think it just, brings a lot of, knowledge. And one of my favorite things is teaching. And so, this is just something I really look forward to. And I think we all kind of discussed that thyroid would be a really good topic to talk about because, there's so many times where even in my own profession, I've had patients and clients tell me that their doctor only runs TSH, right? Which is thyroid stimulating hormone, that they won't run other thyroid labs. We've got so many other thyroid labs. We have T3, we have T4, we have reverse T3, we have, the anti-TPO and TGA, and those are autoimmunity markers, right, for a thyroid. And it just surprises me that so many practitioners only run TSH, especially when that's a pituitary hormone. That's not even a thyroid hormone. So I think it would be really interesting to kind of dive into that today.
Yeah,
Sounds
I'm kind
good.
of excited to hear about it because I've never explored thyroid, to be very honest. It's never been in my wheelhouse, but I've heard many people talk about they have a thyroid problem. And it's always, I'm like,
Or it runs in the family. Oh, our family has thyroid issues.
Yeah, my sister does. My sister has Hashimoto's, and my aunt also had a thyroid issue. I'm not sure exactly what her problem was. I luckily have escaped any kind of issues as far as I know, based on a doctor saying, yeah, you're like right within this range and good enough kind of idea. But
Yeah. And that does bring up an interesting thing. There's so many people that I talk to who's, like you just said, oh, my sister and my mom, they have thyroid issues, but I've been told that my thyroid's, labs are normal. And for me, I really look at optimal. I don't really look at normal range, right? We really look at optimal range because I could have somebody come in with crazy thyroid levels and they should be symptomatic, not sympathetic, but symptomatic. And yeah, maybe they're sympathetic. I don't know. But they're, you would think that they're symptomatic, but they're not. Or you get somebody who's within a normal range, but they're, chronically gaining weight, their skin's dry, they have constipation, or they have the opposite. They have hyperthyroidism, right? Where they're like chronically, having diarrhea. They have, heat intolerance, heart palpitations, anxiety, all of that. So yeah, it is very interesting because a lot of doctors will run labs and they'll be like, oh, well, you're fine because your labs are normal. But really, everybody's very different, and what's normal for them might not be normal for somebody else, right? Which is why I look at the optimal range. So ideally with thyroid, in the US, I know that Canada has a little bit of a different range, but it's similar. About, being at about a 2 with your TSH is pretty good. Like if you're like a 2.5, 3, and you're not symptomatic, probably you're okay. But if you are symptomatic, if you're not technically in that hypothyroid state, but you're gaining weight, you've got cold intolerance, your skin is dry, your hair's falling out, constipation, all of this, if you're symptomatic, then guaranteed you probably have a little bit of a thyroid issue, right? And so that's why it's also really important to look at autoantibodies, right? Because we can have hypothyroidism, which doctors are like, oh, we don't know what the cause is, but it's not, autoimmune related. Or you have Graves and Hashimoto's. Like Tracy said, your sister has Hashimoto's, which is an autoimmunity hypothyroid, right? So the thyroid is attacking itself. And then Graves is the opposite. It's an autoimmunity that causes hyperthyroidism.
I'm just letting it all process.
Yeah, I'm like, wow.
I know. I was like, I think I'm talking too much.
No, you're not. And you talk about this range. So like, I know there's so much information here. So let's start at the beginning a little bit.
Mm-hmm.
If you talk about the dry, you talk about hair falling out and you talk about the dry skin. And as I'm sitting here, you're also talking about symptoms of menopause,
Mm-hmm.
similar to that.
Mm-hmm.
So how does a woman or male, whoever, understand, or is it that's why you go to the doctor to understand, is it menopause? Is it a thyroid? Is it this? Is it that?
Mm-hmm.
Is that what you do? And what does a person look for to try to understand where to go?
Yeah, well, definitely making sure that you're I always talk about advocating for yourself, for your health, all of that. So really advocating and making sure to find the right doctor that's going to run the tests, right? Because our doctors work for us. Okay. I work for my patients. The patients don't work for me, right? So if they request a lab, I should be able to explain why that lab is necessary, why it might not be. But usually I'm like, hey, if you want to run it, absolutely. Right. But oftentimes you have doctors who don't want to run labs that you want them to run and I've gotten the excuse of, oh, I don't know how to read that lab. Okay, you're a doctor, you got to learn how to read labs, right? That's basic. So really the beginning is, finding a doctor, advocating for your health, really finding somebody who's going to listen to you, who's going to run the labs that you want, right? Because basic labs are really good. And if you want a full thyroid panel, that's your right to have a full thyroid panel. Nobody should withhold that from you. And then also looking at where you are in your age, right? Are you in premenopause? Are you in menopause right now? Are you postmenopausal, right? Are you in andropause? All of that. So really looking at where you are kind of cyclically in your life, right? And from there, we can kind of decide, okay, is it menopause? Is it something else, right? Because oftentimes we'll kind of go through almost like a hyperthyroid kind of yo-yoing state, if you will, when we're in, going through menopause, right? We get the hot flashes, but then we start to get the weight gain, and then we get the hot flashes, and then we're really cold. And so it's like, but really those are other hormones that are kind of, causing those to happen. So really, I like to look at where you are in your season of life, what's going on with labs, and is there a deeper cause, right? Because when we have, let's just say hypothyroidism, because I think that that is a very common thing that a lot of women come to me about. A lot of times doctors say, oh, it's idiopathic, meaning we don't know. We just know that your labs say that you're hypothyroid, that your thyroid is under functioning, but we don't know why. Oftentimes it's gut health related, it's adrenal related, it's liver related, because our liver has a lot to do with converting our thyroid into active thyroid hormone. So we've got, the T4 and the T3. So T4 is inactive and it gets converted into T3 in the liver. So if we've got a really gummy liver and it's kind of not well oiled and it's just kind of backed up, being able to convert thyroid might not be an issue with your thyroid. It might actually be an issue with your liver. So I really like to run a lot of different things, looking at your gut health. Do you have leaky gut? Because some of our thyroid is also converted in the gut. So really looking at the systems, because our body is whole, right? And we talk about this a lot. It's, mind, body, spirit, all of it. It's not just your heart is separate from your liver and your liver is separate from your, reproductive system. Like, it's all connected in this system. So if one thing is not working well, then another thing might suffer. And then another time too, let's say if somebody comes to me and they've got thyroid symptoms, but their labs aren't really showing that they might be in a thyroid state of issue state, I don't know, then I look at adrenals, because adrenals, if we're low in cortisol, it can mimic hypothyroidism. If we're high in cortisol, it can mimic hyperthyroidism. So really, I take it all in and I do a comprehensive exam with my clients and with my patients, because I know that not one thing leads to another. Like, it's all connected. So I love the puzzle and I love putting it together. And I don't like to just say, oh, it's your thyroid and that's it. But why is your thyroid, right? If it's not autoimmunity, what is it?
So when are we looking at this? So you have children. Do you start looking at their thyroid when they're 6? Do you look at when you're 20? When do you start really thinking about your thyroid? If there's no actual symptoms, when do you start really being aware and start taking care of it, or being aware of where you stand?
Yeah. So, I mean, for adults, so kids are a little bit different, but definitely for adults, I mean, we should be having blood panels run every year, once a year, right? That's looking at CBC, which is looking at your blood, looking for infection, anemia, all of that.
Right in your 20s, like right.
Yeah.
Okay.
Like right as you're an adult, 18, you know,
Okay.
even 17. Again, kids are a little bit different if they're symptomatic, you know. I don't do a lot with children, but I did when I was in school. We did do some blood panels with children to see, you know, why are they gaining weight? Because I did work a lot with like the Hispanic community. And so really we wanted to look at, do you have diabetes? How's your thyroid? All of that. So for kids, if they're symptomatic, absolutely. But for adults, you really want to get blood work done every year and really make sure that it's comprehensive. Make sure to get a full thyroid panel, because blood, we can really look and see things and catch things early too. But not always, but sometimes, right, when it comes to thyroid, or like, you know, if we're kind of heading into like an anemic state, we can actually see patterns in blood showing, oh, you're kind of going towards anemia, you're kind of going towards hypo or hypothyroidism. So really getting yearly blood work, because then too, we can see a pattern. If something's different, then we know. But if you come in, you know, once every 5-10 years, we don't really know what your pattern is, what's normal for you.
So what I'm hearing is that yearly exam is like your, how do I want to say this? Having a yearly exam is crucial to keep on top of your health, no matter how you're feeling.
Mm-hmm. Yeah. Yeah. Because every year I like to look at, how's your blood work? How's your kidney liver function? How are your hormones doing? You know, is there something that's changing? But yes, regardless of how you're feeling, every year running the, you know, the blood panels is really important.
So you get this diagnosis. Let's just say you are informed you have a thyroid condition.
Mm-hmm.
And I've heard you talk about a couple different levels of within this. It's similar probably to any other illness. There's always different levels. Mm-hmm. Is it treated through a medicine? Is there a way to not self-heal, but can you do a change of diet, do herbs, do whatever to also help with it?
Yeah, absolutely. And that's where a functional doctor comes in, or even, you know, a naturopathic physician like myself. We can treat it, you know, depending on what level you're at, we can treat it with medications. We can treat it with, you know, supplements along with medications, or we can just treat it with supplements and or herbs. There's a lot of different options, but also nutrition is a huge thing. Like I'd mentioned, a healthy liver, right? So if we're eating processed foods all the time and not really taking care of our liver, that's basically, it's not basically, it is the filtration, right? Like our food, once it gets absorbed into our lymphatic system, into our bloodstream, it goes to the liver to be filtered out, to filter out toxins, bacteria, viruses, all of that. And it's also there to, you know, be able to process. So if we're constantly bombarding it with, you know, external toxins and just gunk, we start to slow it down. And that's where we start to see other issues. So yeah, really just making sure that everything is kind of well oiled, especially with nutrition. And so with, you know, so I kind of talked about like hyper and hypothyroid, right? Which are non-autoimmune. And then we've got the autoimmune. So Graves, which is autoimmune hyperthyroidism, and Hashimoto's, which is autoimmune hypothyroidism. For those patients,
There's not a test at the end of this, right?
No. Well, I don't know. Maybe there
like,
might be.
Okay, I got them.
It'll
okay.
be a written test. Don't worry.
Continue on.
You know, so really with these patients, I tell them to cut out all gluten because gluten mimics our thyroid hormone. And so if you've got an autoimmune thyroid condition and you're eating gluten, your body is going to attack your thyroid even more because it thinks that it is the thyroid hormone. So
Have
for my
have you ever heard of that before? Oh, I've never heard of that.
Yeah.
Wow. Okay. Good to know.
Yeah. So really for those patients specifically, like all autoimmune people, I'm like, cut out gluten. Always cut out gluten. It is just so hard on the system. So for all my, you know, autoimmune people, you've got to cut out gluten. Dairy is another one that's very inflammatory that I really am like, okay, definitely gluten. And then second up is going to be dairy. So really making sure that you're cutting out those inflammatory foods. So for my autoimmune people, no gluten. There's a lot of different, you know, recipes. I know gluten-free bread is not always tasty, but there's alternatives, right? And so we really kind of have to decide, are we going to protect our thyroids or are we just going to, you know, eat the bread?
What would happen if you ignored the symptoms of your thyroid? So let's just say you ignored it and you didn't go, what could like happen within your body? What could happen if you ignore these symptoms?
It can be pretty devastating on the body for sure, because, you know, depending on what level you're at, oftentimes I see people go hyper or hypothyroid before it's an autoimmune condition. So personally for me, I used to have just hypothyroidism and my antibodies were on the verge of being Hashimoto's, but I was able to stop it from getting there. So if you ignore symptoms, it's just like a car. When your check engine light goes on, and Michelle, you might have been talking about this. I don't know. Maybe used this analogy recently. But if your check engine light goes on and you go to the mechanic and you're like, just clear the light. And they do. Okay, the light's cleared. Okay, so the light, your check engine light are the symptoms. So we've just ignored the symptoms. Okay, we've just suppressed them. But we haven't fixed what's going on. So then your check engine light comes on again. And the longer it progresses, the more damage you do to your car until it breaks down. And so that's essentially what you're doing to your body, is if you're ignoring the symptoms and you're just ignoring and thinking it's going to go away, it will rear its ugly head and turn into something much grander to get your attention. There's a point where our bodies are like, I'm done being ignored and you're going to listen to me. And one of my favorite quotes is, you know, health is wealth, because really without your health, how are you going to do your hobbies? How are you going to provide for your family? How are you going to be able to keep up with your kiddos? You know, another thing too is if we ignore it, we're essentially ignoring ourselves, ignoring our intuition, which can be pretty damaging too, right? It kind of leads, you know, if we kind of go into more of like the psychosomatic form of it or like the spiritual form, if we're ignoring our intuition, we start to trust ourselves less and less. Our confidence starts to go down. So it kind of goes along with each other, if that makes sense.
Yes. That makes total sense.
Mm-hmm.
Wow. So it goes back again to maintaining, really having benchmarks of where you are in your health and taking ownership of it. And a lot of us don't do that.
Yeah.
Mm-mm.
Yeah. Yeah. There's another quote that kind of goes around the internet, and it's like, if you don't make time for your health, then your health will make you make time for it eventually. Right. So yeah, really, like you said, Tracy, benchmarking where you're at, looking to see what your patterns are so that we can see if there's a change. And then, kind of repeat something. Is it just a fluke, or is this something we really need to look at? So really getting a baseline reading of what you are normally so that we can see, hey, there's a difference happening. Is that difference between you because you're going into, your premenopausal, your postmenopausal, all of that? Is it because, your gut health or your liver health is kind of struggling? So yeah, really just making sure that we're getting our yearly blood work, right? And making sure that we're listening to ourselves and not ignoring ourselves. If we want to kind of dive spiritually too, thyroid relates to the throat chakra. So really speaking your truth, do you have the confidence to say what you're thinking or how you're feeling? Because oftentimes if we suppress that, I've seen a lot of people who don't speak their truth and they end up having some hypothyroid issues because they're just kind of suppressing that area.
Oh, that's interesting.
Yeah.
Wow. I like that one. I'm feeling a little something here. Okay, then.
Well, it's funny because they always say when you feel something, like they'll say, like you, Dr. Beth, or I've had other people, where are you feeling that right now in your body? And that makes sense.
Mm-hmm. Yeah, because we do store a lot of all of our emotions. We store all of our emotions, and where we store it's very different. You get people who are like, oh, I store my stress in my back. That's not false. There are so many people who are so stressed that they're hunched over and then they're just super tight in their neck and their back. And then you've got people who hold sadness and grief in their hips. We store a lot of just suppressed speaking our truth and all that in our, throat area. So we do really store a lot in our body, a lot of trauma, and it can kind of move around too, so really just paying attention to how you're feeling, why you're feeling that, and not ignoring it is really important.
I think that's the biggest thing. Don't ignore it.
Yeah.
And if your doctor is saying to you, fluffing you off on it and not listening to you, we've said this before, Dr. Beth and Tracy and other shows, then go get another freaking doctor.
Yeah. Get somebody who's going to listen to you, because there's nothing worse than feeling dismissed in the doctor's office. There's nothing wrong with you. You're taking up my time. Yeah. When you really do have symptoms or you feel a certain way. Yeah.
Right. And medical gaslighting, I've talked about it in the past. It is a real thing.
Yeah.
Oh, it's all in your head because your labs are normal. Okay, obviously my labs might be in normal range, but it's not optimal range, right? It's not in my head. And I like to tell people, you are ultimately your best doctor, right? Because I don't know what it's like to be in Michelle's body 24/7. I don't know what it's like to be in Tracy's body 24/7 or Tracy Gurney's body 24/7. I have no idea. I know what it's like to be in mine, to live with my pain and, all of that. So really finding a doctor who dismisses you, shut the door on them.
Yeah.
Run away as quickly as you can and don't stop until you find somebody who's going to listen to you, who's not going to gaslight you into saying your labs are normal, it's all in your head, because that's where, that's where a lot of issues come in. That's where a lot of the mistrust of doctors has come into, for a good reason, for a very good reason.
Yeah.
I don't know what it's like in the States, but and Tracy, I'm not sure where you are, but certainly in Ontario, there seems to be almost a shortage of doctors. It's really hard for new families to try and get a doctor. Like a lot of times it has to come from a referral of somebody else, or, you know, like they get to be a part of, you know, your family doctor through marriage or, you know, live-in conditions or whatever. It can be really difficult. Are you guys experiencing the same thing in the States? Shortage of medical doctors?
We are. I've actually lost a couple doctors in the past 2 years. Some of it has been from the pandemic. They're just wish
Yeah,
they're
that's
changing
changed things.
careers.
Yeah.
And there have been some that are retiring or going into another field. So there is that also on that aspect. And so depending on the health level you're at, I have gone and seen physician assistants, you know, as like the building block to get me to a doctor that would be further needed.
Yeah.
So I don't know if you have that in Canada, but within the States, a lot of doctors have the physician assistants. And then you see the doctor if there's elevated risk for something that you have to see.
I don't think we have that here.
No.
Do we, Tracy?
No.
No. And so like, I'm thinking of the person who is like, they are basically doctorless. Like the only time that they ever go see a doctor is if in fact something is wrong. How do they go about trying to find somebody who, like, I want to do a yearly, you know, everything test, right? Like how does somebody do that? And I don't know, Dr. Beth, if you'd be able to even answer that, maybe for the people in the US for sure, but certainly in Canada, I'm not sure what that looks like. And actually, if anybody's listening to this show and has that information, please put it in comments, because that would really be beneficial for anybody else who's listening to that going, yeah, like, how do I do this? Like, if you figured it out, let us know what that looks like for sure. Because there is such a tremendous amount of people. I know, like, for example, my brother-in-law, he moved away from his main town. He went to a totally different town. He couldn't get a doctor at all. Like, there was just like, nobody would take him on. And there was just not, like, their practices were full. They couldn't take anybody else on. And it was like, you know, for him to get testing, it was like he had to be really ill. He had to go to the hospital, basically. You can't walk into a walk-in clinic and say, I'd like to have a full lab done, and I'd like to have somebody, you know, do a stress test on me and whatever else that you want to have done. Like, you can't do it. I mean, there's private clinics here in Ontario that you can go to, but that costs quite a bit of money to go and get those tests run.
Yeah. So. Yeah. And definitely there is a disparity too in the States, you know, depending on what state you are in the US, you know, it can be really hard to find a doctor. But like Michelle was saying, we've got physician's assistants, so PAs, we've got nurse practitioners, we've got even chiropractors in certain states can act as a primary care physician because they have gone through medical school, they've been trained. You know, in Arizona, I think that there is a lot, right? So there's not a lacking there, but in New Mexico, for sure, my sister, it was like a year to get into her primary care physician's office. And so I eventually told her, go to your gynecologist because they can run hormone labs and all the labs. So I don't know if that's an option in Canada, but if you have a gynecologist, you know, or somebody, they, you know, in the States can run all your labs. And usually they're pretty good about being like, oh, you want a full thyroid panel? Awesome. You want everything? We're going to run everything. They're really good about that. So are nurse practitioners a lot of times. So really it just kind of depends on who you're going to see, but there is, you know, depending on what state you're in, there can be a disparity and lack of medical care. So, you know, that might be again, I'm not sure what the logistics are in Canada, if, you know, if your gynecologist or, you know, anybody else can really run those labs, but if they can, and that's who you can get into right away, definitely, I would suggest doing that. But yeah, for like my sister in New Mexico, I told her to get in there immediately because they were able to get her in in 2 days and run her labs versus waiting a whole year when she's symptomatic, right? So
Yeah.
Mhm.
I have a feeling that here in Canada, you only get to see a specialist, like somebody who, like a gynecologist or whatever, only if you have been referred again through your family doctor. Like you can't just go book an appointment with a gynecologist. You just can't do it here.
Yeah, you always have to go through your doctor first.
Yeah.
And then
Yeah.
your referral can expire as well.
Yes. 1 year.
Yeah. So
So
then
if you
start
don't
it all over
consistently
again.
see, yeah, if you don't consistently see that person,
Yeah.
then you have to go, and that's like, I mean, that's it. A classic example with a dermatologist as well. So my husband has to get a referral every year to go back to the same person every year in order to have the appointment. It's ridiculous.
Wow.
So I
Yeah,
can
that's
Sorry, I was
very
just going to say, so when we talk about people maybe putting off stuff, I can see how sometimes they go,
Yes.
oh, well, I should get
This is a
that
hassle.
yearly,
Yeah.
but now I'm not, because by the time this is too much, it's 5 different phone calls or appointments to get in there. So you still
Yeah.
should do it, but I
Yeah.
can see why
Yeah.
it starts to become more than just a yearly blood panel
Yeah.
work.
Yeah.
yeah.
And I mean, you can get blood panels like through naturopathic doctors, etc. But then, of course, you're paying quite a bit of money in order to have those tests run. It's not like it's not covered under, the OHIP or, whatever you guys have out in BC, Tracy. But yeah, like, and, again, depending on your demographic, like you just don't have that money to do that kind of stuff.
Mhm.
Yeah, it's
And
not an easy, it's,
it isn't.
we preach that we should be healthy and to keep these
Mhm.
appointments, but there is, I truly believe, and even within the States, yes, we have PAs, and you're right, Dr. Beth, I have used my gynecologist before I had an internal medicine doctor because I didn't have a need for one, but she would run my panels for me on that. But then we go into the whole cost, which is a whole nother freaking thing, because not everybody has insurance.
Mhm.
And so you want to do it, but you can't financially do it, so that's a whole nother
Yeah.
topic.
Yeah.
I don't
Yeah.
even know if I'd ever want to approach that one, because that's a hard one.
Yeah.
It
You know,
is.
that's an
I think
unfortunate one.
the whole situation, I think when it comes to the medical field, like you guys are facing different scenarios than what we face up here in Canada in terms of your insurances and all that kind of stuff. We're fortunate enough up here in Canada to get like baseline medical stuff for free, really. And yet it's really hard to get a doctor. So it's really hard to get those baseline things at all, because you can't get a doctor, and that makes it difficult. And then there's the whole difficulty in terms of being like, we've talked about this before too, going to the internet to try to get your information. It's like, I mean, you're told this guy will tell you one thing, this guy says something else, this guy says something else, and it's like you don't know what you're doing at the end of it. To say nothing of walking into a supplement store because you think you might have some problem, and you're like, okay, I'm gonna go see, I can't sleep, and like the supplement section and sleep is like right, you're like, oh, I guess I'll take one of everything and just see what happens,
Yeah.
right? It's like, it's really difficult, and it's so important to be able to have that baseline so that you know how to move forward, and to also, have that care. And I mean, I'm really fortunate. I have a family doctor. I can get referrals. We are very fortunate from that standpoint. I don't take it for granted either, because it is a benefit, no question about it.
And like Dr. Beth said about seeing the patterns, right? So
Yes.
you get to see the patterns, and you get to understand your health that much more.
Yeah.
Right.
Plus the fact that they then take into consideration other factors, like the fact that my sister does have Hashimoto's. It's like, okay, maybe they're looking at things differently because that information is available to them than if I just simply walked into a clinic somewhere and said, can I get my blood panels run? And, someone's going to look at them for me. So yeah, there's like so many benefits of having a family doctor, a family practitioner who's going to take care of you. or, you know, somebody like Dr. Beth, who's going to do the whole full spectrum of things
Yes.
for you and understand your family history and all of that,
And
you know, because there's a lot of care that goes into that.
And just talking about family history. So is this like heart disease that it carries on through, like if my parents had it or one of them or my grandparents, it's going to come down the line, thyroid issues?
So, you know, pretty much everything and anything could be a genetic thing, right? I have had it where, you know, multiple people have come down with certain diseases and they're like, this isn't even a family thing. Like, we don't have a history of this in the family, but epigenetics, anything can, you know, our genes can get turned on and turned off at any point in our life, you know, depending on the type of food that we're eating, what kind of toxins are going in, our stress levels. Like, the people who are, you know, chronically in pain and sick, like chronically, you know, even autoimmune, most of the time they were chronically stressed before they got sick, because stress just wreaks havoc on the entire body. And for, you know, myself personally, my thyroid was on the verge of Hashimoto's, right? It never got there because I was making sure to do the labs, making sure to go in and get checked out, but also making sure to do stress reduction, to make sure that my liver was functioning okay, to make sure that I was doing, you know, the exercise, nutrition, you know, those 4 things that I talk about: sleep, exercise, nutrition, and water, right? So really implementing those things. And it just sounds so simple, but you know, it's not
the basics, right?
Yeah.
I also want to say that I think that this is also one of those generational things. We've talked about that before, whereby our age group, the 3 wow ladies, not that you're not a wow lady, Dr. Beth, but that like the older women on the show, we were sort of brought up that it was like, okay, you get diagnosed with something, the doctor's going to give you something and you take it, no questions asked. Like, you don't go, wait a minute, is there an alternative? Can I do something else? Can I change my diet? Can I, like, what else is available to me? Whereas I think our kids now are in an era where they're like, there's so much information available to them. They know to ask those questions, or are much more aware of the fact that there could possibly be an alternative or another opinion.
And also that the doctor isn't always right.
Yeah, exactly. So like my sister, who was diagnosed with Hashimoto's, she was put on medication for it. It was like, okay, well, I'm just like, I just take something for this. It's like, that's what happens. Like there was no questions about, is this right? Is this wrong? Now she has, like, as the awareness has happened, but I mean, she's been on medication for like a long time. But I mean, it's only been in the last, you know, few years that she's become aware of being able to help support herself really through diet and things like that she's been able to, you know, help that along. So it's interesting, I think, that dynamic exists between the 3 of us. Yeah.
But it's not always generational. And here's why. My oldest son has a thyroid condition, supposedly. I am going to say that, supposedly. His doctor says he has thyroid and he's on meds. So I'm like, okay, so what's the blood work? And have we checked out the nutrition? And we've done that. Well, I don't have time, Ma, to get all my blood work done. It's just been too busy. So the doctor's just putting me on these meds. And yeah, I'll check in so there is some generational, and then there is some, this is what my doctor said, I don't have time, I'm just going to do it.
Yeah.
And I have, all 3 of you know of my children, you know, the different dynamics of my children. And so here I am, I have 2 different dynamics. I have a child who is, yes, this is what the doctor said, that's just what I'm going to do. And I have another one who's like, yeah, no, I'm going to find another way, you know. And if the last resort is I need the medication, then that's the one I'm going to take. And I like want to shake my oldest one because I'm like, no, like, okay, let's do the medication, but let's try other things like now, Tracy, your sister is now doing
Yeah.
to help
Yeah.
with that. You
Mhm.
are only going to be 40 years old. Give me a freaking break. You have not even reached, possibly you're at whatever of your life. You could be taking this drug forever.
Mhm.
Like, stop.
Mhm.
And nothing against having to take medication.
No,
That's not what I'm
Yeah.
saying at
Yeah.
all.
Yeah. Yeah.
Mhm.
no.
Yeah.
But you
Sometimes it's
also should be
necessary.
helping the medication somehow.
Exactly.
Mhm.
Exactly. Yeah. Yeah.
Absolutely. Yeah. Because I'm definitely not against, I'm very much so pro pharmaceuticals when we need it. You know, it's just like, I'm not an ER doctor. If you get your arm chopped off, do not come to me. I don't want it. Go ahead and go to the hospital. Go get it sewn back on. That's not my motto. But I also understand when emergency medicine is needed. I understand when pharmaceuticals are needed, you know, to be life-saving. There's absolutely nothing wrong with it. What the problem is we start to get into this over-prescribing where we don't need to. We get into this fixation of, oh, this is going to fix, this one pill is like, there is no quick fix pill.
Yeah.
There is no pill that's going to fix you, because guess what? Most pills have side effects, which you then have to take another medication for that side effect, which then causes more side effects that you have to take a medication for that. And it just keeps going on and on. So like you said, Michelle, really supporting the medication, supporting our body, right? Because we can use that as a support, but it's not our crutch. It's not regrowing our leg that we lost, right? So really the education around medicine for me is that, yes, absolutely, it's necessary. Is it necessary lifelong? Possibly, depending on what's going on with your health and what, you know, diseases you have. Absolutely. But there are some cases where you don't need to be on the medication forever, right? As long
Yeah.
as we get your health to a place where it's supporting itself. So yeah, that's a big, that's a whole nother topic.
Yeah, we keep
Yeah.
going down these other
Yeah.
topics.
Yeah. I think also, you know, it's, we tend to look for that pill, because then we don't have to change anything. We don't have to change lifestyle. We don't have to change our diet. We don't have to, we can just keep doing the same stuff. Just give me the pill and I'll be okay. And it's much easier to do that. And, you know, our brain is always going to go easy, easy. Let's do the easy stuff. So if someone's going to offer a pill to fix it, then it is easy to do it, right? It's like, sure, I'll take this one today, not a problem.
It's that
So
instant gratification we talk
Yeah.
about also.
yeah, it's
But we
crazy.
don't look at the consequences.
No,
No,
we don't.
we
Like
don't.
Dr. Beth was saying, all the side effects. So I'm going to take this one pill today, and in 2 years, something else has all come out from taking things
Yeah.
that there might have been alternates. Again,
Yeah.
I don't want to say you don't take medication, because
Yeah.
Yeah.
I drink
We
my
all
wine
believe
every
in
night.
medication. We're not downplaying medication.
Yeah.
Yeah.
We're advocating to work to find other ways of supporting your body with your medication if it is needed. Okay.
Yeah, absolutely. Nothing wrong with medication,
No,
but it's not a quick fix pill.
no.
And it goes
So-
back to you knowing your body and you supporting your body, and you're the only one, I think you said this earlier, that knows you. And so you're going to be the best advocate for yourself. Like,
Yeah.
take care of yourself.
So Dr. Beth, before we close, because time goes by so fast when we're talking to you, and what is I know you've given some things about thyroids. There's been so much within this broadcast. What is your top 2, 3 things that you would, again, like to recap or, you know, really drive home for people? Because, you know, you've given us so much information.
Yeah. So really, ultimately, get yearly blood work done. I know that in Canada, it's a little bit harder than it's, you know, is said to just go do it. But if you can, try to make the effort to go do that. Really getting that baseline to make sure that everything is checking out every year so that if there is a change, you notice it right away, right?
Mhm.
That way you're not flying blind. You're not ignoring symptoms to the point where you've got chronic diseases. So really find the baseline, get your yearly blood work, advocate for yourself. If you have a doctor that's going to gaslight you, isn't going to run the labs that you want because I don't know how to read it. Okay, obviously that doctor got an online degree, so you need to run. Or they're just being lazy. So really advocating for your health, find someone who's going to be knowledgeable, who is okay with saying, I don't know the answer, but I can definitely research it for you. I don't know is one of my favorite things. Like I never play it off like I know something. If I do not know something, just like with kids, I'm like, I don't really work with kids, right? That's a whole nother realm that I don't work with.
Right.
I never will say I know something if I do not. So really finding the doctor that's going to listen to you, really is going to advocate for you as well, right? Is not going to gaslight you, is going to understand that you are your best doctor. And again, like I've talked about, water, sleep, nutrition, and movement. Those 4 things. And don't rely on medication to save you, right? If it's something that's life-saving, absolutely don't stop your meds. That's not what I'm saying. Really take it under the advisement of your doctor, but just know that there are so many symptoms and diseases that can be supported through lifestyle changes, dietary changes, and you can eventually possibly come off that medication, right? I'm not making promises, but I know for myself and for clients, I've been able to come off thyroid medication myself. I've been able to, get Hashimoto's patients to a place where their autoantibodies are no longer there. They're not taking medications. They're doing really well. I've worked with diabetic patients, right, who were on loads and loads of medication to the point where they no longer have diabetes mellitus, right? And this is not type 1 that I'm talking about, which you need insulin. This is type 2, which is a lifestyle disease. So there are so many things that we can do. And I do work with clients from all over. So if you have questions, reach out to me, feel free to reach out to me and see what questions you might have. I'm always, like I said, I love teaching. So yes, get your yearly blood work done, advocate for yourself, run away from gaslighting doctors, and those 4 nutrition tips.
Well, as always, Dr. Beth, it has you've blown our mind with all this information. And, if we will put your website again back into the comments when we broadcast this. And please, anybody, if you have any form of comments or questions for any of us or for Dr. Beth, please put them down in the comment section. And also, don't forget, if you find that this topic resonates with you, share it, subscribe, tell a friend. I don't know, Tracy, am I missing anything?
Hit the notification button so you're
Hit the
notified of our
notification
next
button.
video.
So, okay, knew I was going to
But you were
miss one
good.
thing.
You're good.
I'm getting there. But again, Dr. Beth, thank you so much for coming on the show.
Thank you.
Thanks for watching, and we hope to see you as a regular member of our community.